Some are scared. Some are depressed. Some are hiding their scars. Some are alone. Some are confused. Some hear voices that tell them to kill themselves and kill others. Some cannot share their deepest secrets. Some feel sick. Some are drunk due to circumstances of life. Some go to bed angry. The voices they hear, the things they see, the way they perceive things, the way they behave, the way they eat, their world is shattered. The World Health Organization defined mental health to include subjective well-being, perceived self-efficacy, autonomy competence, intergenerational dependence, self-actualization of one intellectual and potentials, among others. The WHO further states that the well-being of an individual encompasses the realization of abilities, productive work, contribution to the society, and coping with the normal stresses of life. Now, when this individual can no longer cope with the stresses of life, when there is no productive work, when he cannot contribute to the society, there is a mental disorder. A mental disorder is usually associated with clinical significant distress and disability in one's academic, social, and activities. So they affect the person's intellectual behavior and thinking. They include depression, which is loss of interest in daily activities; schizophrenia, which is characterized by hallucination, hearing of voices and seeing things they are not supposed to see; drug and substance abuse, they are addicted to drugs; mood or panic disorders. I could go on and on. This leads to suicide, violence, or even death. What is stigma? Stigma is when the society starts seeing these people in a negative way due to their mental illness. Stigmatization deprives patients of mental illness of treatment and social support. Due to stigma, those affected, especially the youth, do not admit that something is wrong with them. Bill Clinton, a former president, says, and I quote, "Mental illness is nothing to be ashamed of, but the stigma and bias shame us all." How do we control this? How do we stop this stigma that have deprived patients from coming out for treatment? First of all, we should encourage the youth and make them know that they are not alone. We should focus on the positives and not on the negatives. We should offer cognitive therapy and behavioral therapy for patients with mental illness, health education and campaigns. Once something is wrong, we should see a psychiatrist. We should not label those with mental illness. We should be role models. There should be zero judgment. We should not judge those with mental illness. We should urge them to open up once something is wrong with them. If these people open up to you, will you listen to them? If they speak up, will you give them listening ears? Will you make them know that they are enough? It's time to change the narrative of mental health in our country. It's time to increase the conversation about mental illness in our country, Nigeria. It's time to put a stop to this stigma once and for all. I am Nze Annastasia Chikodi. I am a mental health advocate, and I will fight and advocate to stop the stigma against mental health in our country, Nigeria. Long live Dr. Chinedu Umeadi Foundation. Thank you.